If tongue and lip ties were just a tissue problem, then why do so many babies still struggle after they're released? Why do adults with no visible ties still have airway issues, jaw pain, poor posture, and chronic tension? The truth is, ties are rarely the root problem. Tension is. And here's another truth that nobody tells you. When your baby with a tongue tie also struggles with reflux, colic, constipation, or can't sleep lying flat, the whole tie isn't the whole problem. It's a sign your baby's nervous system is stuck in stress mode and struggling with nervous system dysregulation, and a problem that goes at least one level deeper in the tongue and lip ties themselves. Research shows that about 10% of babies have a tongue or lip tie. But what about the babies who also have digestive issues, sleep disturbances, and just can't calm down? Those aren't 4 separate problems. That's just one nervous system showing up in 4 different ways. The revision addressed the issue, but if the nervous system tension remains, the body just recreates that restriction, and the perfect storm of neurological dysfunction likely still marches on. So it's not surgical failure, it's your baby's body trying to protect something much deeper. This video is for parents who feel like you've done everything right with the tongue tie release, yet feeding and sleep challenges still persist. Are you watching this with a toddler or young child who had their ties surgically revised years ago, but now still struggles with sensory issues, speech delays, motor tone and coordination issues, and developmental challenges? You'll discover why ties often come back, or why struggles continue even after perfect surgical technique. You'll understand the nervous system connection and foundational root cause that providers miss, and you'll learn how addressing the foundation first addresses everything, not just feeding, but sleep, digestion, and your baby's ability to regulate and calm. We work with a family whose daughter, Brooklyn, struggled from the moment she was born, and it was something that they went to the doctor, they went to the nurses, they went to the hospital, just struggling latching, struggling feeding, and that led to just some gas problems, some digestive problems, which can lead to developmental problems. And so they were on track to get revision. And what they did much differently was that they got chiropractic care before and after. So they were able to release that tension before she got the successful revision, and then afterwards to keep that tension removed. And she really thrived afterwards. They even took a trip to California, because before she would have problems just lying on her back, or even just riding in a car, in a plane, just any kind of travel was a no-go, because they just couldn't go anywhere because of that. So they took a trip to California and they had a blast. She was able to be in a car, a plane ride, no struggle at all. And imagine that, if you can't travel now you can. It just changes your family dynamic big time. So that was a huge story for us, and a huge testimony that tongue ties are most often a symptom. It's not the root cause. It's the neurological tone that dictates soft tissue tone. So when your baby's nervous system runs in high stress mode, what we call sympathetic dominance, muscles throughout the body just stay this tension, including tiny muscles and facial tissues around the tongue and the jaw. So think of your nervous system like a car with 2 pedals. You got the sympathetic side, which is the gas pedal, and which mobilizes energy, increases heart rate, creating muscle tension for protection. The parasympathetic side and the vagus nerve side, that's the brake pedal, activating calm, relaxation, and regulation. So when subluxation is present in the upper cervical spine and cranial bones, the gas pedal gets stuck on and the brake pedal doesn't work. Your baby's entire body stays in fight or flight protection mode. The body creates tissue restrictions as a protective response to the deeper dysfunction. Ties are compensatory protections, not the root cause themselves. The tongue is neurologically and fascially connected from head all the way to the toe. When there's tension anywhere in that system, the tongue often adapts by tightening and shortening and appearing tied. Tension patterns start early and they stack over time. This is what we call the perfect storm. So it starts with prenatal maternal stress, then birth interventions, then you get trauma, toxins, nutrition, all layered tension within the system. So why do some babies have ties while others don't? It's accumulated stress during critical developmental periods. For prenatal stress, the sympathetic nervous system for mom and baby becomes frequently just overstimulated, and it becomes hardwired for stress over time, altering how the baby's nervous system develops. Then we have birth interventions like forceps, vacuum extractions, induction, prolonged labor, apply forces to the delicate upper cervical spine and the cranial bones. This creates subluxation right where the vagus nerve and other important nerves that control the tone and tension of the soft tissues of the tongue, lips, and mouth originate from. The vagus nerve and other cranial nerves control tongue movement, jaw coordination, swallowing reflexes, digestion, heart rate, emotional regulation, and immune function. So when cranial bones compress at the skull base during birth, it affects this critical nerve. This is why your baby with a feeding challenge also has reflux, colic, and just can't sleep. It's not separate issues, it's one nervous system stuck in stress mode. This is why releasing the tie is often just not enough. Without addressing tension, function doesn't fully change. The nervous system is still stuck in fight or flight, which is that sympathetic dominance. Muscles don't know how to relax. The posture, movement, and breathing patterns just haven't changed. So addressing the foundation first, that's where the real lasting change happens. It requires a couple things though. Number one, activation of the vagus nerve, which is that parasympathetic side of the nervous system that brings on rest, relaxation, and regulation. Two, structural balance plus proper alignment. If this isn't restored, the subluxation, tension, dysregulation pattern just comes right back. If the nervous system doesn't feel safe, the body will just re-tighten. That's why tension care before and after a release is so critical. But here's the positive side effects of getting your child adjusted. Sleep improves, digestion improves, congestion clears, your baby is happier, more regulated, more connected. These are signs of a nervous system that is shifting into a balance that's in a regulated state. Sometimes the journey to get here on this outside is not so easy and straightforward for our little ones, and they end up stuck in stress and tension mode. But neurologically focused chiropractic care works to release and clear out that underlying nervous system tension so that everything can shift and improve, not just feeding, but sleep, comfort, digestion, and the ability to thrive. If you're ready to address the foundation instead of chasing symptoms or going back for another revision, comment ties below and we'll send you additional resources and a link to get scheduled with our office, Petersburg Family Chiropractic here in Petersburg. Your little one and entire family deserve root cause solutions, not just chase symptoms, but get all the way to the foundation. That's where lasting results truly come from.